Fatigue is a common complaint that affects millions of people worldwide, and it can have a significant impact on daily life. Fatigue is more than just feeling tired after a long day. It's a persistent sense of exhaustion that doesn't go away with rest or sleep. It can affect physical, emotional, and mental well-being, making it difficult to carry out normal activities. If you've been struggling with constant fatigue, it's important to understand the causes and the management strategies available. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's dive into some of the possible causes, evaluation, and management strategies of fatigue. Fatigue can be caused by a variety of factors. It might stem from lifestyle issues such as lack of sleep, poor diet, or high levels of stress. However, it can also be a symptom of an underlying medical condition, including sleep disorders, infections, autoimmune diseases, mental health conditions, or even certain medications. Because fatigue is so common and can have multiple causes, proper evaluation is key to identifying what might be contributing to your exhaustion. The first step in evaluating fatigue is to consider your sleep patterns. Are you getting enough sleep, and is it of good quality? Many people underestimate how much sleep they actually need. Adults generally require about 7 to 9 hours of sleep per night, but beyond quantity, the quality of sleep is crucial. Sleep disorders like sleep apnea or insomnia can cause fragmented sleep, leading to fatigue even if you think you're getting enough hours of rest. Sleep apnea, for example, is a condition in which breathing repeatedly stops and starts during the sleep. This disruption can prevent you from reaching the deeper stages of sleep, which are essential for physical and mental restoration. Risk factors include heavy snoring, apnea, where you temporarily stop breathing, obesity, having a large neck, and being male. If you suspect a sleep disorder, it's important to consult with your doctor. They may recommend a sleep study to evaluate your sleep quality and diagnose any disorders that could be affecting your energy levels. Next, your healthcare provider will likely ask about your daily habits and lifestyle. Factors such as a poor diet, lack of physical activity, or excessive alcohol and caffeine consumption can all contribute to fatigue. Eating a diet high in processed foods, sugars, and unhealthy fats can leave you feeling sluggish, whereas a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can provide your body with the energy it needs. Regular physical activity, even moderate exercise like walking, can improve energy levels and help combat fatigue. In contrast, a sedentary lifestyle can contribute to a cycle of low energy and poor motivation. Another important factor in the evaluation of fatigue is mental health. Conditions like depression and anxiety are often associated with fatigue, and they can be overlooked because people may focus on the physical symptoms rather than the emotional or psychological ones. Depression in particular can cause a person to feel drained and unmotivated, even if they are sleeping enough. If you're experiencing persistent sadness, lack of interest in activities you once enjoyed, or feelings of hopelessness in addition to fatigue, it may be helpful to speak with a mental health professional. Stress and anxiety can also take a significant toll on your energy levels. When the body is under constant stress, it activates the fight or flight response, which can drain your energy reserves over time. Chronic stress can lead to burnout, a state of emotional, mental, and physical exhaustion. Identifying and managing sources of stress through relaxation techniques, mindfulness, or even professional counseling can help alleviate fatigue associated with anxiety and stress. In some cases, fatigue may be caused by an underlying medical condition. Your doctor may run various tests to check for common conditions associated with fatigue, such as thyroid disorders, anemia, diabetes, or infections. Hypothyroidism, for example, occurs when the thyroid gland doesn't produce enough thyroid hormone, leading to symptoms like fatigue, weight gain, and depression. A simple blood test can evaluate thyroid function and determine if this is a contributing factor. Anemia, another common cause of fatigue, occurs when the body doesn't have enough red blood cells to carry oxygen to tissues and organs. This lack of oxygen can leave you feeling exhausted, weak, and short of breath. Iron deficiency is a common cause of anemia, especially in women, but other forms of anemia may result from chronic diseases, vitamin deficiencies, chronic blood loss, or genetic conditions. Chronic fatigue syndrome, also known as myalgic encephalomyelitis, is another condition that may be considered during the evaluation process. This disorder causes extreme, long-lasting fatigue that doesn't improve with rest and is often accompanied by other symptoms such as joint pain, headaches, and difficulty concentrating. The cause of chronic fatigue syndrome is not fully understood, and the diagnosis is typically made after ruling out other conditions. Check out my video on chronic fatigue syndrome for more information. Infections such as mononucleosis or even long-term effects from viral illnesses like COVID-19 can also contribute to prolonged fatigue. Sometimes the body takes a long time to fully recover after fighting off an infection, leading to what is known as post-viral fatigue. If you've recently had an infection and your fatigue has persisted, it's worth discussing this with your doctor. Once the evaluation process has identified possible causes of your fatigue, management can begin. In cases where fatigue is linked to lifestyle factors, making changes to your daily habits can have a significant impact on improving energy levels. Improving sleep hygiene is a critical step. This means setting a consistent sleep schedule, creating a relaxing bedtime routine, and ensuring that your sleep environment is comfortable, quiet, and free from distractions like screens. Dietary changes can also help manage fatigue. Eating a balanced diet with plenty of fresh fruits, vegetables, whole grains, and proteins provides the body with the nutrients it needs for energy production. Avoiding excessive sugar and processed foods can prevent energy crashes that can occur after a spike in blood sugar. In some cases, dietary supplements may be recommended, particularly if fatigue is linked to a nutrient deficiency, such as iron, vitamin D, or B vitamins. Exercise is another powerful tool in managing fatigue. Although it may seem counterintuitive to exercise when you're feeling tired, regular physical activity has been shown to boost energy levels in the long run. Exercise helps improve circulation, boost mood, and enhances sleep quality. Starting with gentle activities like walking or stretching can gradually increase energy and stamina. For those whose fatigue is linked to an underlying medical condition, treatment of that condition is essential in managing symptoms. If hypothyroidism is the cause, thyroid hormone replacement therapy can help regulate energy levels. For anemia, iron supplements or other treatments depending on the type of anemia may be necessary. In the case of chronic fatigue syndrome, there is no specific cure, but management strategies such as pacing activities, cognitive behavioral therapy, and medications to alleviate symptoms may be helpful. Mental health treatments may also play a crucial role in managing fatigue. If depression or anxiety is contributing to your fatigue, addressing these issues through therapy, medication, or both can lead to significant improvements. Cognitive behavioral therapy, in particular, has been shown to be effective in helping people manage chronic fatigue, especially when emotional and psychological factors are involved. Learning stress management techniques can be equally beneficial. Practices like mindfulness meditation, deep breathing exercises, and yoga can help lower stress levels and improve overall well-being. Reducing stress not only improves mental health, but can also lead to increased energy and reduced feelings of fatigue. It's important to remember that managing fatigue is often a gradual process. There may not be an immediate fix, but by working with your doctor to identify and treating the underlying causes and taking proactive steps in lifestyle adjustments, most people can see improvements in their energy levels and overall quality of life. If you're dealing with persistent fatigue, it's important to take it seriously and seek professional help to understand the cause and develop a treatment plan. Fatigue can be a signal from your body that something needs attention, and by addressing it, you can regain your energy and get back to living a more active and fulfilling life. Thank you for watching. If you found this video helpful, please hit the like button and subscribe to my channel. Leave a comment below if you have any tips for others dealing with fatigue. As always, take care of yourself and make the most of your day.